Dr. Mary Zennett, thank you very much.
Thank you all for being here this morning. This is such a critical topic. I want to consolidate my talk into 4 main points, and I want you to each have a solid grasp of these points as we move forward with needing to battle Initiative 20 and get down to basics. What does it mean to have real health reform? Okay, number 1, quality. I would challenge everyone in this room to ask themselves, when have you heard anyone talk about quality in healthcare? Since before Obamacare, okay? Leading up to Obamacare, does anybody talk about quality? I'm sorry to say, I haven't heard it. Healthcare providers are working their fingers to the bone to try to deliver quality in a system that absolutely ignores what it means to deliver quality to patients. When we say quality, what do we mean? Caring about the patient, integrity, sanctity of the doctor-patient relationship, time. Who today has time to spend time with the patient, deliver a quality product? Okay, so keep that point in mind because we'll go back to it. Number 2, bureaucracy. Since the advent of Obamacare, probably the one thing that has exploded beyond everything else is bureaucracy. What do we mean by that? There's oodles of unelected bureaucrats. There's paperwork, as you heard from Dr. Jill Vecchio. The paperwork is endless. It's unlimited. What does it mean? I consider myself a little worker bee in the system. I've been a practicing psychiatrist, MD, full-time since 1986, and I've watched all these changes over the years. What I see since the advent of Obamacare is we spent a large amount of our time dotting I's, crossing T's, shuffling paperwork. Now, think about the first point, quality. What does quality have to do with this endless stream of bureaucracy? I would challenge the system and say it's inversely proportional. The more bureaucratic we are, the less time we have to focus on quality. So, we heard Dr. Joshi talk about Medicaid expansion. Medicaid, if nothing else, is a huge bureaucracy here in Colorado. And it's critical that every one of us know and are very well aware of what's going on right now. It's estimated that Medicaid pays about 50 cents on a dollar to hospitals, providers, the people providing the service, okay? But the bureaucracy is probably close to double. You don't see statistics, but practicing, you feel it. It's, wow, we get in at the crack of dawn. First thing we've got to do is make sure our Medicaid patients have their forms filled out, their reviews are done by 11 o'clock in the morning. We have to answer everything that's going on for that Medicaid patient. It's taken center stage in a health practitioner's day. And we ask ourselves, why are there so few providers left? Because doctors were trained to practice medicine, not to fill out endless streams of paperwork. So keep bureaucracy in mind. We're going to keep moving forward. Number 3, the cronyism. You've heard some of this already. I'm very sorry to say, but cronyism has become front and center stage, a driving force, one of the main driving forces in health reform. Who are the 3 major parties? Number 1, Big Pharma. We know this. It's not all of pharma. And please know, I have friends in all these industries. This is not about people. It is about principles. And that's where we have to separate ourselves. We like many of the people, but we despise the system. We despise what healthcare has become. So number one, big pharma. Well, they've got a huge lobbying seat at the table. They're front and center with all the health reform debates and solutions. Number two, the big mega hospital conglomerates, okay? They're putting the small hospitals out of business. They're scooping up doctors' practices. They're putting the little people out of business. And number three is the mega insurance companies doing the same thing, putting the small, ethical insurance companies out of business. So, while they're profiting, here we are, wondering what our next healthcare cost is going to be. So keep that in mind, the cronyism. If you have any doubt, look up, there's a medical journal called The Lancet, a very respected journal. On December 5th, 2009, was the front cover. The U.S. health reform hearings expose how corporate influence renders the U.S. government incapable of crafting healthcare policy based on evidence and the public interest. Let that sink in. Corporate influence renders the U.S. government incapable. Okay, so we've got 3 points so far. Quality, or lack of it. Bureaucracy, just exploding. Cronyism. Number 4, a lot of people don't even know this huge entity exists in healthcare, and that is the managed care industry. This got really big in the HMO era of the 90s. It was very painful for many of us in healthcare. What does that mean? It's an invisible layer of bureaucracy. And I might add, it affects the public as well as the private sector. Very large in the public sector, I might add. These are third-party reviewers, doctors, nurses, people that really are not very much trained in healthcare, who will tell you after you've had a service whether or not it's going to be approved. So in other words, you could have insurance that covers, say, 10 days in a hospital. But the managed care company says, you will have 3. And they give all their reasons. So people like me, like I said, little worker bee in the system, I spend a lot of time trying to advocate for my patients, say what we're doing is medically necessary. Standing up, we're not just wasting people's time. If you need this care, you should get this care. And I think that's the one area in healthcare that goes unnoticed. People don't even know it exists until you get a bill and say, your coverage was denied. You were covered for 3 days in the hospital, even though you were in the hospital for 10. So keep these 4 points in mind. Quality, bureaucracy, cronyism, the managed care industry. Okay, now let's look at single-payer health care. Let's look at each of these. Quality. What do you think is going to happen with single-payer health care? Look at models around the world. Look at models in Britain. Okay? It becomes one size fits all. Quality diminishes more than it already is. Bureaucracy. What do you think will happen with a single-payer health system? I don't know how bureaucracy could get any bigger, but it would. It would explode because that's what these systems do. What I've noticed working in the system with people who have Medicaid, any government-run health care, again, these are not bad people. I know these people. They are well-intentioned. But there's a big point that seems to be lacking in their analysis of what's going on. What I've noticed is they don't look past a day or 2. People who function in the public sector or reviewing the public sector, it's like their concern is what happens today, what happens tomorrow. And we're going to talk a little bit more why we need a longer-term perspective. It's almost completely lacking in the current healthcare system today. Okay, so single payer, lack of quality, exploding bureaucracy, cronyism. Does anybody believe that the cronyism is going to be less? Folks, the cover of the Lancet said it all. It's not going to happen. Cronyism would explode with a single-payer model. That means people are going to profit at the people's expense. Number 4, managed care. Right now, public sector has large amounts of managed care. It would only explode with single payer. Now let's quickly flip to what a free market system would look like. Number 1, quality. Quality explodes. Why? Because dollars are being spent on innovations. Bureaucracy diminishes. Ask any small business owner. You've got to be efficient. You're going to keep your lights on. You've got to cut costs. You've got to cut bureaucracy. You've got to cut administration. And you've got to focus on quality. Yeah, we need that. Number 3, cronyism. Okay? A lot of people who are really for a public sector model hate the corporations. But guess what? They're the ones profiting the most. In a truly free market system, we, the consumers, decide who we want to support. And the word will get around quickly. You got an ethical healthcare company, ethical providers, ethical insurance, ethical farmer. Yeah, we want that one. We, the people, can put the cronies out of business. We're the only ones who have that privilege if we're in a model that allows us to do that. And that only comes with freedom of choice. Okay? So do we see, same with managed care, and I'll tell you, I would challenge any, we can get back to a free market system, I would challenge any insurance company. Let's see what a model would be without managed care. Let's do it ethically, limit the cost, be very, very judicial. It can be done. It can only be done in a free market system. Now, have that backdrop, have your bullet points, and let's now move to the foundation of what we're dealing with. The foundation, Dr. Joshi already talked about it. It is this unfathomable national debt. Any government-run health care is being paid for by debt currency. We know that. I believe our friends and family don't know that. Our opponents certainly don't know that. But we cannot ignore that we are paying for health care on debt. Other countries own us. China primarily, okay? And later I'm sure we'll talk more about this. I heard Dr. Joshi say, there's no dollars. There's no dollars. And I will challenge anybody who says that they care about the poor. If you care about the poor, how can you look them in the eye and give them health care that may be gone tomorrow because it was funded with debt? So we need to understand. We need to speak this language. And we need to insist on a system that's affordable, accessible, lower cost, with higher quality, that's available to everybody. Now, real quickly, there are some examples around the country of Medicaid trying to be privatized. Now you hear people laugh, oh, they think that's funny. Oh. They're afraid, I know, I read some of this. The cronies are gonna get carried away with it. None of it's done ethically. And there are good legislators, good people who are saying, wait a minute, we've got a debt-based currency. Medicaid is broke. There's no tax revenues to support Medicaid. So, if we shift, get people jobs, this is where it all gets down to looking at the big picture. People have jobs, You can transfer their Medicaid to a private policy, then get them a job, then they can have that private policy, and guess what? They don't need Medicaid anymore. And these are the kinds of initiatives and reform that we need to start thinking about now, because it is unsustainable. Now, real quickly, it's my firm belief that the left hand doesn't know what the right hand's doing. Let me give you 2 examples of this that has to do with our federal payers. Medicare, okay, well, there's needless to say, if you read the reports of the Centers of Medicare and Social Security, every year they issue these dire warnings. There's no money. Well, that's true. Population's aging, costs are rising. Okay, we hear that loud and clear. They always issue some solutions. Nobody's listening, but they do. In 2014, their solution was on the healthcare providers. Well, if the healthcare providers were more efficient, we could get these costs under control. And I read that. I had to shake my head. I said, no, wait a minute. Obamacare has mandated these bureaucracies. They mandate this paperwork in all volumes of it. So please tell us how we can become more efficient. Please. I really want to know. I'd love to go back to the day where you could have a little SOAP note, your subjective, objective, assessment plan. That's how we used to years ago. Care for patients, your little SOAP note, very efficient, everything was done. Yeah, we can do that, but you have to scratch Obamacare, scratch government health care. Because government health care, by its very nature, is very bureaucratic. But then you have the CBO. Very interesting organization, the Congressional Budget Office. They had an article fairly recently on how would we lower the federal debt. And their health reform column, their solution was reduce Medicaid spending by the federal government. Once again, who's reading? To close, I would encourage you to please think about all these principles. Digested healthcare, like Dr. Vecchio said, it seems very complicated. It all boils down to these basic principles, and when you become savvy with them, you understand the principles, you can stand firm on why we need real health reform. And I would ask you, I have a white paper I wrote last year detailing a lot of these points in more details. Please take a copy. If you want more copies, we can get you more copies. Share it with your legislators. Share it with your friends. Share it with your families. Because what you've heard already is that real health reform is going to be about us. So thank you very much.